referred to the cardiac arrhythmia service because you have an abnormal heart rhythm. Many times, these abnormal heart rhythms can be fixed with an ablation procedure. When you present for an ablation procedure, your doctor will first perform an electrophysiology, or EP study, by placing catheters or tubes through the veins in your legs up to your heart to determine where the abnormal rhythm is coming from. During the EP study, your doctor will decide whether to proceed with the ablation procedure. If your doctor performs an ablation, this will also be done through the veins in your legs. At the end of the procedure, all of the tubes or catheters will be removed, and closure devices may be placed on top of these veins to plug up those holes. These closure devices are collagen plugs that will dissolve over the next several weeks. You cannot see these devices, and they do not need to be removed. If you press very hard over these areas, you may feel a little marble-sized spot there, and this is normal. This will go away over the next several weeks. On the skin itself, you will just see little puncture sites as if you had big intravenous lines there. These will also go away over the next several days. The areas will be covered with big pieces of gauze and some tape. The day after the procedure, the tape and gauze dressings can come off, and you may shower and wash these areas with plain soap and water. Do not scrub directly at this site. Instead, just let the water and soap run gently down your leg. We also do not want you to sit in or submerge this site in water for 1 week to avoid infection. This includes baths, swimming, hot tubs, lakes, oceans, and pools. After you shower, do not put powders, moisturizers, ointments, or lotions on the groin site for a few days. The site may stay open to the air without another bandage on top, but you may also cover this if you wish. It's normal for the groin area to be mildly tender or bruised after the procedure. The bruising may get worse and expand down your leg. There may even be some slight swelling. All of this is normal. The areas should not be swollen more than the size of a marble and should not be severely painful. These areas should not be red or warm to the touch. If you notice any drainage, if the area becomes painful or hot to the touch, or if you see signs of infection such as fever, you should call our office. Activity-wise, you are restricted from heavy lifting or strenuous exercise, also for 1 week. Heavy lifting is considered more than 10 pounds, and strenuous exercise includes running, cycling, elliptical, rowing, yoga, golf, pickleball, using a lawnmower, etc. Walking is okay. These restrictions are to protect your groin site. And lastly, we say no driving for 2 days, given the repetitive motion of using the pedals and the pressure this puts on your groin. There are cases where an ablation might not be possible. For example, this might happen if your doctor is unable to determine where the abnormal rhythm is coming from, or if the abnormal rhythm is coming from an area too close to other structures or wiring in your heart. In these cases, an ablation might not be performed, but you would also still follow the restrictions we just reviewed because of the puncture sites in your groins. Lastly, your heart sits inside of a sac called the pericardium. This gets inflamed during the procedure. Some patients notice chest discomfort after the procedure, especially when they take a deep breath in or change positions. We call this pericarditis, which is a fancy way to say that sac is inflamed. Sometimes we will order steroids to help reduce this inflammation, either as 1 dose to take the day after the procedure or as a dose pack, which is a tapering dose over several days after your procedure. Follow the instructions on the prescription. Additionally, if you feel symptoms of pericarditis, it is okay to take ibuprofen or Advil or Motrin, 3 tablets 3 times a day. You may have been told by your pharmacist in the past that you should not take ibuprofen with your blood thinner. While ibuprofen can make you more prone to bleeding, we would not want you to take it every single day for the rest of your life while you're on a blood thinner. However, it's more than okay to do this in the short term. Tylenol typically does not help with these symptoms. If you find that after a few doses of ibuprofen, this chest pain is not getting better, or that you still need ibuprofen after 3 to 4 days, these are things your doctor would want to know. Finally, many patients are discharged the same day as their procedure, depending on the time their case is finished, how long the procedure took, and what they found during the procedure, and how you feel after the procedure. If you meet our criteria for a safe discharge, you may be sent home the same day. Otherwise, you will be kept overnight for monitoring and likely discharged the following day. Someone from the team will see you prior to your discharge and will review all of your medications and any new prescriptions that you might need. If you are able to be discharged the same day as your procedure, you will need someone to come pick you up from the hospital as you will not be able to drive home. This person will need to be available to review your discharge instructions in person as you will just be waking up from surgery. You will also need a companion to stay with you at home overnight. If you were discharged the same day, someone from your doctor's office will call you the following day to check in and to see how you're feeling. They will ask about your groin sites, your prescriptions, and can answer any questions that you may have. You will then have a follow-up visit with your doctor or their advanced practice provider in the office in 6 to 12 weeks. If you are having any symptoms, please call the office. If you have any general questions, you may call the office or send a message through Patient Gateway. Please note, we do not check Gateway messages overnight or on weekends.